During the COVID-19 pandemic, the IPRO ESRD network program has identified barriers in the coordination of care of shared patients between dialysis and long-term care or nursing home facilities. In this video, we will cover key information that all dialysis, nursing homes, and transportation providers should know. Catherine Stotmack from Logisticare will be sharing their best practices with you.
Thank you, Alexandra, and thanks for having me today. Today we're going to be talking about nursing home and dialysis transportation through a pandemic and really what the best practices are for delivering quality and safe transportation during this time. I'd like to first start out with a little bit about Logisticare. We are really a national leader in the healthcare transportation space. This is a benefit allowed currently with 24 million members. It's called the Non-Emergent Medical Transportation Benefit. We service in 50 states and have done last year alone 63 million trips. Our call centers really touched 37 locations nationwide, and we were able to manage 25 million calls with partnerships through 6,500 transportation providers. We've got 3,500 employees nationwide and partner with various associations, including the National Kidney Foundation. A little bit about our expertise and scale. We really provide healthcare access through resources in multiple lines of businesses. A majority of our members are Medicaid members, as you can see here. We also serve Medicare as well as duals, but if you look at the numbers in terms of the members that are served and the payers, this is a breakdown of what you see there. In terms of, really our purpose is making connections to care, and I want to talk a little bit about that today and how our reliable services open doors for a very vulnerable population that, specifically dialysis and nursing home patients, and we're able to service approximately 10 million trips annually for this treatment type and facilities. And, we take this very seriously, especially during such a critical time when we've got a pandemic. And one of the ways we do that and manage those trips, we can do it both advance notice by setting up the trip prior to the treatment as well as same day. And really, we've got, experts who recognize the importance and the human element of both medical and non-medical transportation and really take a lot of things into consideration, including the member receiving the treatment, whether it's a nursing home member or a dialysis patient, looking at their level of service. And that's really important to us, and our call center representatives who speak to both the nursing homes and the patient directly discuss what those level of service requirements are, whether they have mobility limitations, the requirements possibly for wheelchair services, or as well as whether there are special needs that really require coordination. And that's one thing we pride ourselves on in terms of training to make sure that, patients' transportation is safe and equally as important, reliable, that we're getting them from point A to point B, timely, on time, all the time. One of the things that we train on is prioritizing safety and responding to the COVID-19 pandemic by really focusing on what the up-to-date guidance is from the CDC. Our Chief Compliance Officer is laser focused on any updates that they receive from the CDC and make sure that those recommendations for the transport the transportation have been included. So that includes, the personal protective equipment. We consider use of larger vehicles and really make sure the transportation provider cleans and disinfects, surfaces that might have been contaminated. Also, we have had partnerships through local health departments in several markets, which really has included additional ways to keep members safe during the transportation as they are getting to, their dialysis center or wherever they need to be to receive treatment. That includes really wearing, gloves, leaving, rear doors or windows open and making sure there's adequate ventilation. We also have partnered with a company called Matrix, which, is one of the leading experts in the space to do assessments on, our business model to ensure we're implementing best practices. Matrix is also partnered with the Cleveland Clinic, so we pride ourselves in making sure that transportation is as safe as possible. One of the things we have found is communication is key. Communication with the CMS guidance and protocols, and making sure that, for example, we were working with CMS in certain waivers to ensure a safe trip. I'll just give one example of if a patient had to sign off on the transportation while in the vehicle, we have found other ways to ensure that ride took place while not possibly exposing that patient through use of a pen or other surfaces that is unnecessary during the pandemic. We also wanted to make sure we asked questions during the booking of a ride so that we can really identify if the member has been exposed or is COVID positive. So we've got a system in place that asks the member questions if he or she is possibly infected with COVID, and make sure we flag that ride and take extra precautions. Expanding along the lines of really what best practices are with respect to these communications and strategies, we look at, reservations from third-party medical providers, and really Logisticare has conducted, a significant outreach to various medical providers and clinicians to make sure we have, weekly operational calls with our, national dialysis partners to ensure we're not leaving anything out, and also to make sure if there are any concerns, they have a voice and that they're heard, so we make sure that transportation is as safe as possible. We also really do a thorough review of all standing orders in this space. Standing order is when we, book a ride in advance and it's a recurrent ride that we can anticipate. And coordinate with the dialysis caseworkers so they're able to, express any concerns and identify possible patients that might be infected. So I think through this, being proactive is key, and this is a collaborative process that really continues to this day, and we only get better at it as the guidance becomes more sophisticated and we learn more about this virus, right? When we look at the tailored communications, Logisticare really also communicates with its transportation providers through town hall sessions. So we not only look at the dialysis clinic and the case workers or managers at the skilled nursing home, but we really make sure our transportation providers are well equipped, and we share information with them through a town hall process where we get all of them in one setting and really reiterate some of the CDC guidelines with respect to mask wearing, the importance of frequency in terms of cleaning their vehicles, as well as best practices as it relates to single loading, multi-loading in passenger vans, so that we ensure that transportation, is as safe as possible, and that patients are not being exposed where they're getting to where they need to be. And this type of treatment is life-sustaining, so we have to do that in the most, and safest way possible. When we look at CMS COVID testing, that methodology for the, long-term care space in the facilities and those testing requirements, CMS has done an outstanding job at implementing, new testing requirements, both in the nursing home space and the laboratories, just both requirements for the staff and the residents, so that they have guidance and reassurance that they are being as safe as possible during this time. That includes, as you can see here, routine communications with the nursing home and other entities about the resident status, and that includes the dialysis facilities. So the facilities really continue to screen staff, and the residents on a regular basis, which is really critical to make sure we've got line of sight into possible people who might be exhibiting signs or COVID positive. We talk about how critical communication is. One of our values at Logisticare and we, is really communicating with purpose and transparency. We are in truly unprecedented times, and we want to be nimble. We want to adapt and make sure we are implementing the best practices as safe as we can. So we really have created customized plans based on specific facility and program needs. So we recognize that really no two nursing homes or dialysis programs are the same, and that requires customized planning to, that's really targeted and designed to accommodate and contain any spread of the virus and ensure, a safe and timely transport to where these patients need to be, so they stay safe, as well as the facilities stay safe, right? Because that's really important to us. And we pride ourselves on the partnerships we have, not only with CMS, but the nursing home facilities as well as the dialysis clinics. And these are some of the number of practices that we believe to better assure, as experts in the transportation space, that these services are as smooth as possible for our members, including what we talked about, the proactive communication, booking transportation in advance so we can ensure we've got coordination as to, what the patient is experiencing, as well as whether the facility has any concerns in advance of that ride. And really making sure that the customer and the patient is wearing a mask, and that's either being provided by the facility or making sure that can be arranged prior to the transportation. Resources is everything. That's at the crux of what we do, making sure access to care is still available during this pandemic. So that, involves the facilitation that we've outlined in detail today. And really, I think all of these steps will reduce the need for transportation provider testing and exposure. And our goal is to obviously not be, limit the spread of this virus, as is CMS's goal as well. Alexandra, I'll turn it back to you, but I just want to thank you so much for having me and really enjoyed talking about how we can prioritize safety during this pandemic.
Thank you so much, Catherine and Logisticare, for sharing your best practices. And thank you guys for watching. For more information, please visit our website at esrd.ipro.org.